We currently have a trauma level 1. We have a advanced certified stroke program. We have a STEMI program. We have all the resources to be a true tertiary care center. In fact, that's already happening. We're getting transfers throughout Long Island to us for people seeking our care, which is pretty exciting.
Hey guys, welcome to another episode of Brain Buzz, where we delve into the fascinating world of neurosciences and brain health. I'm your host, Dr. Kimon Bekelis.
And I'm your co-host, Jason Wallen.
Well, today we're going to talk to one of our favorite folks in administration, but not just an administrator. So we have today with us Dr. Lundbye. Welcome.
Thank you. Good morning.
So we decided to talk a little bit. We focus on, of course, a lot of the medical aspect of what we do in the neurosciences, but we decided to broaden our focus and look into healthcare systems as a whole and administration. And we've been working with Dr. Lundbye in our parent hospital, Good Samaritan University Hospital, almost for the last year. And we're working closely in a lot of projects. And I thought, what a better person to bring here and talk about healthcare systems and delivery of healthcare than you. So welcome. And maybe for our viewers who are not familiar with you, maybe tell us a little bit about yourself and how you got into medicine in the first place. And we'll get to Good Sam at some point.
Yeah, no. Good morning. And again, thank you for having me. So I've had a fairly interesting journey in my life. I started out in Norway, so that's where I grew up. I stayed there until I was 17, came to Connecticut. I went to high school there and then moved on to college and then medical school. Went back to Connecticut where I finished residency and fellowship in cardiology.
Great.
And the reason why I went into healthcare was because when I came to the U.S. from Norway, I had the ability to become a volunteer EMT for an ambulance service in Simsbury, Connecticut, and I learned how amazing it is to be able to help people that have a emergency. So that was kind of the springboard for me to get into healthcare. Cardiology, I love pumps, so I thought it was a good idea to try to do that, and I really did enjoy it. With time, as I was working as a cardiologist, I got more and more pulled into administration, and it allowed me to sort of function in a different capacity. And I realized quickly that if I can lead effectively a healthcare organization, I can probably care for a lot more patients than I can individually. So that's what I did to take that leap, and I really enjoyed it.
Yeah, that's amazing. So why did you come to the U.S. from Norway? I mean, I came to the U.S. from Greece, so I mean, I'm always interested. I came for training, of course, but what was the impetus for you?
For me, it was family. Okay. They wanted to move, so I was defaulted over.
Because for us Southern Europeans, our countries are not that great, but for Norway, most Norwegians stick around. You guys are very advanced, but that's fascinating. So you've been in and around Connecticut for most of your U.S. life, and then Long Island kind of came into picture. How did that happen?
Yeah, good question. So I was the president and CEO up in Connecticut at a hospital there, and I had the pleasure of meeting Dr. O'Shaughnessy, who's our systems CEO, as you know,
right?
Who I found to be incredibly inspiring as a leader. And over time, I had the opportunity to join Catholic Health, which has been a wonderful journey. Of course, I had to relocate down here, which is always a little humbling, especially if you have a 15-year-old boy that's in high school. We kind of made that transition, and I have to say, for the record, he'll probably hear about this. He has been an enormous supporter of this, despite having to leave his friends and networks behind. But it's been great, and we love Long Island. The people here are wonderful. The restaurants are amazing. Beautiful nature. The South Shore, I am so drawn to it. It's been an amazing eye opener for me.
That's awesome. And, you know, it's actually a common denominator for a lot of us that came to Long Island without any prior ties. The Dr. O'Shaughnessy kind of drew us in one way or another. So you've taken over Good Sam, and of course you're doing phenomenal work in a lot of different fields, streamlining several different aspects of care delivery, but also on the back end. But one of your big initiatives and projects is this new patient care pavilion that's already in place on the north side of the hospital. So tell us a little bit about that.
Yeah, that's another amazing thing that we're so excited about. 75,000 square feet of space, and we call it a modernization project. It's not an expansion per se.
Right.
We're building a brand new ER on the first floor, 75 individual patient bays. Did I say 75,000? I meant 300,000 square foot. Sorry.
Much bigger.
The first floor is 75,000 square foot, the ER, and it will be individual bays, which is so much more effective for patient care to be in their own room rather than in a open area with curtains that separate patients. Second floor will have 16 brand new operating rooms, state of the art. Amazing facilities to provide the best of care, not only for our patients, but also have the assets and resources that our surgeons need. So very exciting. And the third floor is a mechanical floor, which doesn't have a lot of things for us to worry about. But the fourth floor is all single patient rooms, 36 of them. Excuse me. It will allow for us to provide the best healthcare that you can with superb technology and all in a private setting where patients can get the quiet and comfort and privacy that they need. Technology, amazing. We have something called OneView coming, which will allow for entertainment, will allow for FaceTiming family, will allow for ordering your food, see who your care team is in your room while you're there. So it's really amazing.
That's spectacular. And of course, this is a foothold into the future. What's your vision of Good Sam as a whole going into the future? Is it going to be another community hospital in the South Shore of Long Island? Is it going to be, the best and brightest hospital in this? What are you thinking?
Yeah, Good Sam is an amazing place. And I say that because I've now been able to see the people. I've seen the surgeons, I've seen the physicians, I've seen all our staff, and they're all amazing. We currently have a trauma level 1. We have a advanced certified stroke program. We have a STEMI program. We have all the resources to be a true tertiary care center. In fact, that's already happening. We're getting transfers throughout Long Island to us for people seeking our care, which is pretty exciting.
Yeah.
So we're going to be not only a trauma level 1, but a tertiary care center where people can send patients to us, but also the best. Right. Not only on Long Island, but I believe in all of New York.
I couldn't agree more. And so, of course, there's a lot of regulatory and administrative pressures that you're feeling on your end. How do you balance that with allowing physicians in the hospital to provide top-level care? Because sometimes there can be conflicting interests from kind of regulatory aspect and then real in the trenches patient care.
Yeah, no, that's a great question. And I think that's what makes healthcare so very challenging, because you do have a huge regulatory arm that sits over and really manages or controls, for lack of better words, healthcare organizations. And you really have to learn how to work with the regulators and also with your staff to make sure you find a happy medium. Sometimes very, very challenging, and sometimes it works out.
And of course, you know Good Sam now from the inside out. What do you think will be the biggest challenges going forward that you have to overcome or work on to realize that vision to make Good Sam the premier destination for New York?
Yeah, that's another great question. I think the biggest thing that I see for Good Sam is making sure that we have all the infrastructure in place to show how strong we are. We need to continue to recruit top-notch physicians, which we're doing. I'm in the presence of one right now, so
well, thank you.
and we'll continue to have staff that really are top-notch. Number two, making sure that we take credit for all the great work we're doing. We do so many amazing things that we don't share with anyone.
Right.
Many people don't know that we're a magnet nursing level of organization.
Yeah.
Top 10% of the United States, right there, right?
Right.
So you're getting the best care when you get to Good Sam because of those types of things.
Right, and if you look at just the facts about Good Sam, it is a tremendous hospital, right? Like you said, a level 1 trauma center, a comprehensive stroke center, a STEMI program, open heart, critical care in every single specialty where you have critical care: surgical ICU, neuro ICU. Medical ICU, cardiac ICU, neonatal ICU, pediatric ICU. This is a spectacular institution that has all the building blocks to get to the next level of excellence. Now, how you've been in administration for quite a bit of time now across your career. Have you seen your role and your job evolving in any way? Is it different than when you started? As everything is changing.
Yeah, no, that's another good questions you got going here. But I haven't. I've always been a very hands-on leader. And I think there are folks that like to be a little bit more, less hands-on, for lack of better words.
Right.
I enjoy being in the weeds. If I see a problem, I like to get my influence on it. And sometimes I'll do it myself.
We like that too.
And it just makes me a more effective leader.
Right.
I will continue to do that.
Do you think that is because you've done clinical work, you've been in the weeds, you've been in the trenches, you've done cardiology, you've done cardiac critical care, if I'm not mistaken,
That's
right?
Correct.
Is that, do you think, why you just want to get it done?
Yeah, well, I think you hit the nail right on the head. You sort of see what the problem is because you understand all the elements that touch that problem. So you can become a much more effective leader because you know the healthcare side, you know the administrative side, you know the mechanicals,
You can get it fixed. So of course, I'm interested in neurosciences, selfishly.
Really?
First time I hear about that. I want to get your take on where do you see neurosciences fitting in this vision of Good Sam for the future?
Yeah, no, I think neurosciences has really sort of gone to the top tier of our portfolio. And you said it earlier, we have such a wide base of different clinical services, but neurosciences sits at the top of that and really is driving a lot of the growth and forward movement that we see at Good Sam because we have amazing people, again, like yourself and other physicians and nurses.
Yeah, and I think your support has been great in terms of developing, like you were saying before, the infrastructure to allow the talent to show.
Yeah.
We are currently in the process of building a second biplane room where we do advanced stroke and cerebrovascular interventions, which will be ready before the new patient care pavilion. And there's a third similar room in the patient care pavilion itself. So we have that capability to expand as our case volume, of course, is very appropriate for that. And in the stroke world, we share a lot with cardiology. A lot of the risk factors, right, that cause a stroke exist in the cardiovascular world with high blood pressure, cholesterol, diabetes, smoking being those big 4 factors, and genetics, of course, that produce cerebrovascular and cardiovascular disease. And I often tell people the story of how you attended our annual conference for neurosciences, and you're rightfully so were making fun of us because of a lot of the advances that are now happening in the brain world have already existed in cardiology, especially in the treatment of atherosclerotic disease. And as far as I'm concerned, you speak my language frequently when I try to explain to you new initiatives or new things that we want to do, and we're very appreciative of that. Now, of course, stroke is a very time-sensitive intervention. And some of the challenges we've had in the past was where our emergency room is currently at Good Sam and the distance that it takes to bring a patient, which we overcome by, people being very aggressive and moving patients and doing things kind of superhuman sometimes. How is the new building going to fix that geographic issue that we have currently?
Yeah. So the new buildings is more of a vertical design. So a lot of the resources that you need, you said it earlier. We have an emergency department now that's separate from a lot of our other resources. The new ER will have a central pod in the middle of the ER that does all the imaging, so you can get it very rapidly done. So you can make that, diagnosis, and then taking it from there, we'll have the ORs right above us, so that you can quickly get access to the operating room and or the biplane room, etc. So it's a whole different design. Geographically, will be much more aligned with the services that we provide.
Yeah, and like we say, function and geography go together in medicine, so that's phenomenal. And of course,
well, in my world, we say time is muscle. In your world, we say
time is brain. Sounds cooler, right? Time is brain sounds a lot better.
It sounds a lot more, I don't know,
sophisticated,
emergent. Muscle is like, okay.
But I do want to point out, not to interrupt you, but
no, please.
The stuff that you all have done, including now having an annual conference, really have put us on the map as the top tier of our neurosciences. And I want to congratulate you on that.
Thank you. And speaking of new developments, I think one thing I want to touch upon was telemedicine, right? And the time sensitivity associated with stroke is prime for the development of teleservices to get care where it needs to happen. And, at Good Sam now, of course, for years, we've done telestroke. So we bring the neurologist to the bedside. And now we're doing also tele-neuro ICU, so that we always have somebody available through a screen, through a computer, through a robot to get to the patient and provide the insight that otherwise you would need somebody to drive in to get it done.
Yeah.
And that is at the forefront not only of Catholic health, but of Long Island and New York. And of course, also artificial intelligence. Everybody's talking about artificial intelligence. People want to spend billions of dollars on developing tools. Well, Good Sam has been using artificial intelligence for stroke detection, identification, team notification for the last 4 years.
Yeah,
I think so.
We've been kind of a pioneer with that.
So those are phenomenal. Thank you for your support in every single one of those principles. Now, in general, like you said, the infrastructure is important. What are you doing to bring the latest technologies? In the neuro world, I have no complaints. We have the best and greatest. But I'm sure in other principles, surgical principles, there's other new technologies that can be brought on. What are you doing to get those technologies into Good Sam?
Yeah, no, that's a good question. So I work a lot with our physicians, leaders, specifically physician leaders. We just brought 2 new robots into the organization. We brought Da Vinci Xi and Da Vinci DV5. DV5 is top state of the art. It has all the bells and whistles that you would imagine. Yes. So, I think it's really partnering with physicians and making sure that we have leaders that can articulate where we need to go with stuff. AI is very exciting, so we've been very proactive on that. We have a full team of IT folks that help with that and making sure that we always have the best and the greatest. And it shows. Look at our new pavilion with the technology that we're bringing into each of the patient rooms, which is amazing.
Right. I was actually I was honored to take a tour of the pavilion, and the second you enter one of those private rooms, the big screen in the room shows your name because it recognizes your badge.
You were telling me about that.
Yeah, which is really cool.
Fun.
Because you have a patient that sometimes in the neuro world they're confused. Maybe even if they're not confused, they're in pain. They have other priorities, and a million people walk through that room. They have no idea.
Well, as a family member as well, if you're sitting there and you have all these people coming, it's overwhelming. You don't know who you're talking to.
Right.
Sometimes you don't know if you're talking to a nurse, an APP, a physician.
Right.
So I think that'll help delineate the situation a little bit better for them.
Yeah.
For
I
sure.
think it gets exciting.
So, kind of if you take a step back and see what challenges you face in the healthcare world in terms of healthcare delivery and how we can survive in the future, including billing and a lot of other stuff, insurance negotiations, all that stuff. What are the biggest challenges that not Good Sam necessarily, but a hospital is facing in this environment?
Boy, yeah, that's a loaded question. I can tell you that every health system across the United States are challenged by some degree of financials, and I say that because it's probably the only industry that you can imagine where we don't set our prices. You can imagine a pizza shop, the cost of flour goes up or your electrical bill goes up, and you can adjust that on the pie. So you put it out to the consumer in some degree. We don't have that luxury. We get told what we get paid, and we absorb it. And so it makes it very difficult. So I think that's one thing. I think we have to continue to look into the future, making sure we keep our patients healthy so they don't come into the hospital,
Right.
so that we can keep them out of the hospital and doing the right stuff. And there's so much amazing healthcare stuff going on these days, the stuff that you do,
Right.
which is sort of, it's at the apex of the forefront of healthcare. But there's so many new medications that change how you manage different conditions. So it's a very exciting time to be in healthcare. But having the affordability to deliver that is also going to be a challenge because people are going to be asking for more and more.
Right.
And so I think those are some of the things that we are challenged with. Staffing, another thing. It's just a different model out there. People don't want to get into healthcare the way they used to in the past.
Yeah.
Well, we saw COVID changed a lot.
Really
of that.
did, yeah.
I mean, we lost a lot of people during it. A lot of people maybe have retired early or decided this is not for me, and then it was hard to replace after that on top of the usual.
Yeah, and one of the things that you see with that, and I find it very interesting, it's called institutional memory or institutional intelligence.
Oh, yes.
But you take a group of individuals that understood exactly how to run a hospital, and I'm talking about the people boots on the ground, which are so important to what we do, and suddenly they retire or leave. Now you don't have that knowledge, and that replacement factor there. So it's
You lose
very
the expertise.
Yes, it's very interesting.
Yeah.
So everything we do gets very much, it becomes slower.
Yes.
But you take a group of individuals that understood exactly how to run a hospital, and I'm talking about the people boots on the ground, which are so important to what we do, and suddenly they retire or leave. Now you don't have that knowledge, and that replacement factor there. So it's
You lose
very
the expertise.
Yes, it's very interesting.
Yeah.
So everything we do gets very much, it becomes slower.
Right. And a lot of what we, a lot of the challenges that you're mentioning with pricing and regulatory, I think our only avenue to try to fix them is advocacy, right?
Yeah.
And using our organizations, the hospital association, medical associations, lobbying, advocacy. That's the only way because, everybody else, insurers and payers, they have their own lobbying arms and they promote their interests as they should as their companies. But on our end, we should do the same thing, and I think, we are actively doing it. I know you guys do it too, but that's the only way we can position the hospital in a better way in this environment. So if you had a magic wand and you could change healthcare in one way, and that's probably not a fair question because I didn't tell you before we started this. What would you change?
I would probably change the way our hospitals and healthcare systems are reimbursed. I hate to bring financials into it. It's the most challenging thing that we deal with. In fact, 25% of all of our claims that we submit to get paid, we get denied, and we don't get a penny for it. So we provide free care. So that would probably be the one thing that I would want to see very quickly change. I do want to highlight, we do have some very strong local advocates for healthcare.
Oh, yeah.
Both Angie Carpenter,
Yeah.
Ed Romaine are both very supportive of what we do.
Yeah. And so you're a physician, you're an administrator, you took that leap. what advice would you give to people to physicians who want to get into administration, and what personality, I guess, would it take for somebody to do that, to go from day-to-day clinical care, boots on the ground, to more kind of a general role, managing personalities, financials, regulatory, patient care, all that stuff?
Yeah, no, I think that's the very fortunate thing that I've had is that I was a physician first. And I think be a physician first so you understand what you're doing, and then use that to integrate into your leadership and into what you're trying to accomplish as an administrator or a leader. I think that's one. I think one of the most effective things that I've seen is that you have to be accessible, and you have to be authentic to the folks that you work with. That probably is the two things that I could advise folks on. You know, don't forget who you are. Make sure you understand you're a physician and you understand and you've learned that piece of it. And then be accessible to the folks that you need you. I'm sort of a servant leader. I really want people to ask for help so that we can help them. So my door is always open, and I think that's some of the stuff I would recommend.
I think we have time for one more question.
All right.
I'm going to selfishly take it.
Oh, man.
What? Do you have a good one?
I have a good one.
All
Well, I
right,
had
go.
2 good ones, but that's okay. Go.
Go. You go then.
That's okay. You can.
All right. I want to bring it back to Good Sam as a community. And you had mentioned earlier that it's looked at as a community hospital when we're so much more now.
Yeah.
And what initiatives, because you said, we have to toot our own horn. What initiatives are you planning for the future?
Yeah, I mean, there's a lot. We both have to do it internally and then externally. So, you have your external customers and you have your internal customers. So internal being our staff.
Yes, absolutely.
They need to hear all the great stuff we're doing. So we're doing some internal marketing as we speak. You've probably seen all these little flashy posters that we have of showing all of our accolades. On the outside, we have an amazing marketing team that's at the corporate side that will do a lot of this stuff. In fact, we have a big campaign coming up in the neurosciences field to share all the great stuff we're doing. But, I believe in follow your path, stay firm on it, and the people will start recognizing what Good Sam is. It's a strong, amazingly efficient, high quality, and we deliver every service possible. And when people start coming to you from other hospitals, that's when you're a tertiary care center, and that's when you really sort of started showing that you have everything that you need. And we're serving the South Shore community with this, which is pretty amazing.
Right.
I'm very proud of that.
Right, that's amazing. And I'm going to overrule
You have time for more.
I'm going to overrule you. And so I just want to bring it back to Dr. Lundbye. In terms of you as a person, like, of course, you're very busy in the hospital. I know you're working crazy hours, almost as much as I do. And that might be in the hospital. You might be going out to dinner to develop relationships and forge referral patterns. How do you find work-life balance, and how do you unwind when you're not Dr.
Good question. So I get up early, so I get to do what I need to do personally, which is exercise and those types of things. I try to make it home several times a week to have dinner with my family. And once in a while, I'll say, stop, let's go on a vacation. We need to get away. In fact, we're going away next week.
Oh,
so
nice.
Awesome.
to get some time away. But, you got to love what you do. And I love what I do. And if you love what you do, it's not work when you go to work.
What kind of hobbies do you have, though?
Well, my wife likes to claim that I deconstruct the house when I don't do anything else, which is probably why she likes that I go to work.
They go to work.
Yeah, so I don't destroy the
He
house.
does do a lot of work in the house.
Yeah.
So
What about cycling?
I do, yeah. So
Yeah.
I cycle, I do exercise. I'm actually going to California next month to do a century ride, 100 miles
Wow.
in the hills of.
I was trying to get that out of you.
Well, yeah. So and by the way, and I say this, and you all say, yeah, duh. The South Shore, the Ocean Parkway, has
Yes,
an
beautiful.
amazing bicycle trail.
Yes.
Yeah.
It's a little flat, but what you will notice is when you have the wind in your back,
Right.
you can go as fast as 30 miles an hour, and I kid you not,
Wow.
on a flat road. But when you turn around and you have to go back, you can go as slow as 10 miles an hour and,
Wow.
and struggle. But so it's an amazing trail, beautiful nature, beautiful scenery. And so I've loved that part of it. Thanks for
Awesome.
bringing that up.
No, and that's a cardiologist that walks the walk. That's why I wanted to mention that. Dr. Lundbye, it was a pleasure having you. I'm looking forward to working with you in the hospital, and I'll see you around. Thank you. Thank you. My pleasure.
Jay.
Yes, absolutely.
And guys, thank you for watching. If you liked our videos, please like and subscribe, and we'll see you in another video.
Thank you.